So, as you know, every 2 years we come out to you and ask you to participate in our survey. And we'd like to say thank you for all those people that took the time. This is really, really important information for us because it gives us a really good idea on what we're doing well and what are the areas that you'd like us to work a little bit harder for you on.
I couldn't agree more, Lynn. I mean, as with previous years, we know that the top services that we provide to you and that encourages you to retain your membership is professional indemnity insurance that comes automatically with your membership. This peace of mind protection alleviates potential risks that you might face on a day-to-day basis with your clinical care.
And it's not just the insurance because, of course, it's all the backup services that we provide in the office, and we often get calls from members who just want that extra little bit of comfort and peace of mind. Now, you also nominated access to CPD as the second most valuable service we deliver. In response to that, we have now started to create a series of webcasts, and it's been quite incredible. We can get over 700 participants at every webcast. So it is saying to us that this is something that you really want, and we're coordinating with our state organisations because we know that you love going to your local conference or going interstate to another conference, and we want to work together to provide the very best CPD offerings that you can possibly get. And of course, when it comes from us, it's going to be good quality. Now, to support you in the office, I mentioned that we've got our PII insurance, but of course we've got a whole lot of other services that many, many members take advantage of. We've got 5 optometrists working here at the national office, not here all the time, but coming in and out and working on a whole range of things. Most importantly, they're working to support you. Of course, one of the other key things is the work that we do with government, advocating around Medicare items and a whole range of other things. And of course, we've got our member hotline. As I said, we've now got 5 optometrists. So when you get on that member hotline, you're going to hear from one of your colleagues who's really well equipped to answer any of your questions.
Yeah, being able to access the member hotline is incredibly important to you, particularly for support around insurance, audits, registration and regulatory information. I was also delighted to see that you very much value the communication that we deliver to you, in particular our email newsletters such as Focus, our therapeutic and clinical magazine Pharma, and our journal Clinical and Experimental Optometry.
Now, of course, also we've got our consumer campaign, and a lot of you mentioned how highly valued that campaign has been. Good Vision for Life is the consumer campaign. We've got a website, but there's been a lot of publicity, and what's really, really pleasing is that we know that people are changing their attitudes out in the community, certainly around who do I go to when I've got a sore eye. The number of people coming back to us now and saying, well, I go to an optometrist rather than a GP. So that's fantastic. Now, we did take a bit of a hammering on our website. Understandable. I'm absolutely with you. But what I'm also really pleased to announce is that we will have a new website by next year. We've been spending a lot of time in developing and planning. We've had a fantastic group of members who agreed to come onto a working group to help us really design something that's going to be user-friendly and very, very appropriate for the kind of needs that you've got on a day-to-day business.
You also tell us that advocacy and representation of the profession is one of the services you value the most and where you see us performing well. Conversely, it's also an area that you want us to do more in, particularly educating policymakers on the important role of optometrists and optometry. Now, we are regularly in Canberra doing just that, and this month have a number of meetings with the politicians.
Absolutely. Andrew and I will be up there quite a few times walking those halls of Parliament on your behalf.
Likewise, you'd like us to work more collaboratively with Ransco, and we have several projects in train to build positive engagement and outcomes for optometrists.
Which is all terrific. Now, we also created Optometry 2040. We were listening to members who were feeling just not in control of their future. This has been a fantastic project. We've been going to every state to run workshops. We've got some more to come. And what's going to be really fantastic is the information that we get from this will help you guide your career over the next 20 years. It will help us in terms of leading the sector for the next 20 years. It's a really significant project, and it really does respond to your concerns, the things that you raise with us about not feeling in control. We'll be able to give you a greater certainty on what the future brings, and you'll be able to come up with the future that you want.
This is a great project for us to deliver in this, our 100th year. To continue to evolve, succeed and support optometry as we have since 1918 means that we must listen and respond to you whilst working collaboratively with sector partners, with the government and with allied health professionals. Because you've told us that we're doing a great job, and we thank you for your ongoing support. Remember, if you ever need to contact us, we're here.